Today I have with me Adarsh from IU Devices, having raised about 2 million USD in funding, a 70-member team. What is it that you're building?
So we are having ECG and phonocardiogram in the same device. Our aim is to make sure the monitoring and screening or detection of these diseases happens as easy as using a smartphone. In Shark Tank we got the offer from Namita, got from Piyush as well.
You were an electrical engineer. Why did you go to a med tech hackathon?
My mother wanted me to be a doctor.
How do I find an idea?
If you want to do something in healthcare, just visit the hospital, just talk to some doctors, see patients, you will get so many problems.
How do you learn as a student to navigate through all of this?
Maybe mentors can play a very big role. We were taught how to go about it. Define, develop, deliver, deploy.
Where did you get the money?
For us again, the ecosystem played. Now also I am seeing there is a lot of programs from DBT, DST, EAR, Nidhi.
How would you measure the success?
Someone is willing to pay for the product that you have made, and that's a huge turning point.
What advice would you give to a student with zero capital?
Capital is not the first thing required to start a company. I mean, as an employer, I'll be more happy to pick this kind of people who have actually ventured out and done something.
Interesting.
Because they will be more practical and they'll know the in and out of things.
Today I have with me Adarsh from IU Devices. AyuSynk is the
Brand name.
from Bengaluru, Karnataka, based here. But Adarsh started about 10 years back. In 2014, after graduating, he started working on a startup with help of some mentors and faculty at IIT Bombay, incubated in Sign, and cut to today. He has a medical devices company, a health tech startup based in Bangalore, doing great, covered already in Shark Tank, and having raised about 2 million USD in funding, a 70 member team, and doing business all across the country. Welcome, Adarsh, to this conversation.
Thank you, Professor Puran. Thank you very much.
So, as we've been discussing since we've met, this conversation is about taking you and taking IU devices to the students.
Sure.
In the morning, I was talking to a battery of 100 campus ambassadors across the country who are helping build this initiative, Guess India, where we are essentially trying to help students take their first step. And there were a couple of students who are studying in a medical degree with the health care background, and they're like, we also want to do something, but we've never heard about business, technology. All we do is bio. How can I become an entrepreneur? Right? So there are several questions that the students have.
Sure.
And through Guess India podcast, we are trying to bring students closer to the entrepreneurs, and vice versa as well. And as you mentioned, one of the reasons you agreed for this interaction is that you also want to give back to the students.
Yeah.
So through this conversation, I hope that we'll be able to bring the reality of building a startup close to the students, so that they can believe in themselves and take the first step.
Sure.
Yeah. Okay. So let us get started with this. We want to, first of all, understand, Adarsh, what is it that you're building? We'll talk about the equipment that we have here, what you have built over the last 10 years. We'll discuss the business a little bit, technology a little bit. But most importantly, then I want to go back to 2014 when you were a student and your journey in the last 10 years. So tell us about the products to start with.
Yeah. So around 70% of the deaths in India happen because of non-communicable diseases, including heart diseases, lung diseases, diabetes, hypertension, cancer, and all. In that, when you look at cardiac diseases, cardiovascular diseases, that contributes to around 32% of the deaths. That's huge, right? And many a time, the patient does not know that he has a problem.
Okay.
Right? So our aim is to make sure the monitoring and screening or detection of these diseases happens as easy as using a smartphone, right? Both at the screening side as well as at the monitoring side.
Okay.
That's our broader vision, and how we do that is first we started with a digital stethoscope. Stethoscope has been there from last 200 years.
Yeah.
Not had changed from till last 10-15 years.
Yeah.
And on the other side we have ear the hearing technologies like AirPods and other things, which has got tremendous audio quality and everything, but still doctors were relying on the old way of listening. And we developed the first product which added all the technological advancements into those older version.
Okay.
And doctor could listen to the better sounds.
Yeah.
That is the
So
product.
this is a stethoscope,
Correct.
and typically you don't see this in a
Yes.
stethoscope,
Correct.
and this is how you wear it.
Correct.
I'm not that kind of doctor,
But
but I'm a
you're
doctor,
PhD doctor.
PhD doctor. So you do it like this,
Correct.
and then you put it on your heart.
Correct. So there is a on-off button. There is a volume control.
Okay, it's on.
And
I
yeah,
put here.
when you keep it, there is a volume you can increase or decrease. To
There's
keep it at the right
Yeah.
place.
So there's a volume button here,
Yeah.
and I can increase the volume
Correct.
like this. Let me see what happens.
Yeah. Are you able to hear? You need to like.
This way or this way?
No. There is a notch on the side of the tube. Can you show where it is turned to?
Yeah.
It's slightly turned here. Now I'll show you. Is it coming?
Now I can hear.
Now can you place it?
Okay. So let me put it here now.
Audible?
No.
Okay.
No heart. Okay. So what it does is it records the heartbeat.
So that is the live hearing, wherein doctor is just enhancing the audio quality and listening in the binaural. The other thing is it can transmit data to mobile through Bluetooth, and then the data either you can record it or share in real time, or you can run algorithms to identify abnormal heart sound or abnormal lung sound.
Okay.
So with the AI algorithms.
So usually the heartbeat sound, which doctors listen to and then do a sort of primary screening, whether there is something wrong, that can now be recorded with this and can be transmitted. So that can be helpful in sort of remote diagnosis, in sending this data over as well.
Correct.
Okay.
So mainly I would say in that case, like the specialists in India are very less in number. Let's say for example of cardiologists, we have around 6,000 cardiologists.
Okay.
But India requires 88,000 cardiologists.
Okay.
And we can't all of a sudden replicate cardiologists, right? So, but technology can reach all the places, and devices like this, which will be used by even physicians or even MBBS student or even nurses, and they will be able to record the sounds and they can share it to doctors, cardiologists, or even they can run the algorithm and find the abnormalities.
Okay.
So the reach of access of healthcare is what we are able to do, and not just heart sound, even the lung sounds also.
Okay.
There are diseases like COPD. It's a third major cause for death, third or fourth, but people don't not aware of it.
So what kind of diseases can you really detect with only the sound of in the heartbeat? So what all diseases can you detect?
So in general, doctors normally won't rely on a single parameter.
Okay.
They will take the sound in conjunction with the history of the patient, the other symptoms and all. So when we look at STETH, what they normally listen is heart sound and lung sounds. And in heart sound, if there is an abnormality, there will be a murmur which sound will be heard.
Okay.
Like how normal heart sound we have heard in movies, lub dub kind of a sound. If there is an abnormality, there will be a murmur in between of it that will sound like lub sh dub. Because the blood is flowing through some pressure.
Right.
And that is an abnormal heart sound.
Okay.
What a doctor looks for. And in that will give disease related to congenital heart disease. It will give indication related to valvular heart diseases. And again, they need to go for a confirmatory like ultrasound or echo. This will help in screening the patient.
Right.
On the pulmonary side, you might have heard pneumonia, then asthma, then COPD. All of these diseases will have abnormal lung sounds, which doctors checks when they place it on the different part other than heart.
Sure.
Right. So that are the diseases that
Diseases.
that can be screened.
So who are you? How many pieces of this are being sold?
Yeah. So more than 11,000 devices we have sold
Okay.
across India.
How many in how much time?
That's been around 2019 we started commercializing to telemedicine companies. 2020 when COVID was at peak, we launched for the the doctors. So for doctors mainly it's from 2020.
2020.
Yeah.
Okay. So in the last 5 years, you've sold 11,000
Correct.
pieces, about 2,000 pieces a year.
Correct.
Okay. Who is buying it primarily?
Primarily it is purchased by I would say physicians, pediatricians, and for them they are I would say habituated to listen to sounds, and from the sounds they will do a good diagnosis. They before even they send to a echo or any high end test, from their side they do preliminary screening, and they will not directly send the patient directly, right? So these doctors they use their hearing ability along with the history taking to relay and come to some hypothesis about the patient condition. And mainly it's clinics who purchase these products.
Okay. Clinics.
Yeah.
I see. So for a student, thinking all of this, so when you were a student, you started back in 2014.
So 2014 was not exactly the time when we started. 2014 I got into this center called BETIC.
Okay.
So BETIC is Biomedical Engineering Technology Innovation Center.
Okay.
It's a lab in IIT Bombay under Professor B. Ravi.
Okay.
Again, the question is same. How can an engineer who does not know ABCD of health, how will he develop something, right?
Okay.
So
Your undergraduation was BTech
yeah, in electrical.
in electrical.
Yeah.
Where did you do that?
I did in Karnataka.
Okay.
Under VTU.
VTU.
Yeah.
Okay.
And I was I would say working in MNC L&T, and that's when this hackathon which was happening in IIT Bombay, conducted by BETIC. The aim of the hackathon was to give the know-how about developing a medical product.
Okay.
That was the aim of the hackathon. So me, then Tapas, my good friend there that time, as well as Dr. Nambiraj, we three were the participants, formed a team, and we were in the hackathon for 5 days.
Okay.
So
Dr. Nambiraj is
he's an anesthetist from Mumbai.
from Mumbai.
Yeah.
How did you know him?
Yeah, through the hackathon. So in hackathon,
You went to hackathon on your own.
correct,
For 5 days,
Yeah.
you were in IIT Bombay's BETIC Center,
correct.
and you met Professor Nambiraj, who is from Mumbai.
Dr. Nambiraj,
He's a doctor, I mean medical doctor.
medical doctor. He's medical doctor.
Okay, okay. You met him, and then okay, so you met Tapas also there.
No, Tapas, we've been friend before that.
Okay, you did your undergraduation together.
No. So it was out of I would say passion for electronics. There was this site called EDX, like Coursera, Udemy,
Yeah,
you know, right?
edX, I remember.
edX.
Yes.
That time was at peak.
Yeah.
So there was a forum wherein they were we were doing a course on electronic interfaces.
Okay.
So in that course, since I was in Mumbai, we thought of meeting and trying to build some cool stuff. That's when I met him, and we were building hobby projects.
This is one of the top questions among students.
Okay.
This question was asked today.
Okay.
I don't know. Usually founders or students, they only have one skill.
Correct.
Then they don't have the rest of it. For example, I know electronics in your case. You didn't know medical, and then you find a doctor.
Correct.
And Tapas is a friend, right, for you.
Correct.
And then the team comes together, and 10 years down the line, here you are.
Exactly.
But for a student, question is, where will I find where will I find my co-founder?
Okay.
And sometimes the question is, sir, you are in IIT. I have an idea. You have all the technological prowess in IIT Mandi with you. Can you build a product for me?
Okay.
So the answer to that question, for the students is you have to find complementary skills. You have to find other people, other students, friends, and in this case, others found Dr. Nambiraj and Tapas, and they started from there.
So
All
maybe
right.
I give a example when I talk about the complementary skill sets required in a startup. So I give a normal example of cricket, like everyone understands it more easily, and I think we can agree maybe MS Dhoni or even Kohli, top cricket players.
Yeah.
But my question normally I ask is, let's say if you have a team wherein all 11 players are like MS Dhoni,
Yeah.
and the other team not as caliber as a national level team, but even a state level Ranji team.
Yeah.
The question is who will win, right? For sure, it will be the state team because you have a
You need
bowler.
complementary
You
skills.
need complementary skills. You need bowlers, you need batsmen, you need keeper, you need spinners.
Yeah.
So even if you are having, let's say, someone from a big institute, if you are not able to get complementary skill set people, the team won't be complete.
Team won't be complete. And how do you find the co-founders is as I said, a big question. Now, this was not planned, this was coincidental, just met at a hackathon. So did you plan that this would happen? Why did you go to a medical, med tech hackathon? You were an electrical engineer.
Yeah. So it's an interesting story. So I come from a very small town in southern part of Karnataka. The place is known for coffee. It's Chikmagalur is the district name.
Okay.
So in that, my mother was a nurse, and all my childhood I spent in a hospital quarters.
Oh, I see.
And in front of my house, on the one side, I could see house of a doctor, and my mother wanted me to be a doctor.
Okay.
But this doctor was the single doctor in the whole hospital.
Yeah.
I had seen the challenges he was facing.
Okay.
So like patients, come from far places, wait for him to see him, even at night. So they, they knock the door even at night.
Okay.
So I thought if I become a doctor, this is my case. So I thought, let's not become a doctor, and I became an engineer. So that was the story behind that. But I had seen the
And
challenges.
now you come back to again, you're not a doctor, but you're helping doctors do what they can do more effectively.
So that was the backstory, that healthcare challenges I had seen, but I did not know I can do something. Then Tapas showed me one documentary in which engineers were building medical devices.
Okay.
That was a starting point that, you can, being an engineer also, you can actually develop in medical field.
Okay.
And we try to understand more and try to build small ECG project, Arduino and very simple stuff. Using YouTube, we try to make this, projects, not of any significant accuracy or any significant value, just for hobby.
Okay.
That time we came to know this hackathon was happening in IIT.
Okay.
That's when we applied for it.
Okay.
And it was almost like, I would say, kind of God aligned everything together. So we went there together and hoping to learn how to do this.
Right.
We just knew how to make some electronic circuits, not to develop a product. And in the hackathon, we got a framework taught by Professor Ravi and Dr. Rupesh.
Okay.
That define, develop, deliver, deploy.
Okay.
The frameworks for developing a medical product.
Say it again.
Define, develop, deliver,
deploy.
So starting from defining the problem statement, understanding the stakeholders, understanding the pain points, starting from that, we were taught how to go about it.
Yeah.
That's when the knowledge related to development came to picture, and we made the proof of concept of a product, and then we joined the lab, and then we developed the product. Now finally we are here.
Okay, let's not fast forward. we want to go into detail.
Okay.
So what I hear is, childhood, you had some memories, right? You wanted to escape becoming a doctor. You had a friend. He showed you a documentary. There was YouTube. There was internet which was available. Okay, and then there was a hackathon.
Correct.
And then there was God
Aligning
all of this. So the question for students is, how do I find an idea? Several people have an idea. When I meet them, they're like, I have this idea, I want to do something like this. And others are like, I'm fascinated by how entrepreneurs are building what they're building, and can I also do it? Right? Where do I find an idea?
Okay.
How do I know a good idea? Right? So and I have spoken to some student entrepreneurs before. And there is one common link that we figured out, which is childhood.
Mm.
During childhood, you have some memories, you have some experiences, you have something that shapes you, something that inspires you, either sends you away from it or attracts you,
Eventually
whichever
attracts.
eventually attracts you. Um and friends and whatever is around you, and of course what all is becoming available to us, technology, YouTube content that we can consume freely, all of that is creating a lot of opportunities for students today to identify problems. So listen, be observant, talk to people, see what is around you, and the problems are everywhere.
Yeah, I mean, if you just go in a vehicle to any tier 1, tier 2 place, or if you want to do something in healthcare, just visit the hospital,
Yeah.
just talk to some doctors,
Yeah.
see patients, you will get so many problems.
I recently came across something called a Jagriti Yatra. Do you know about it?
No.
I think somewhere in MP, um, there is this Jagriti Yatra which is organized. A group of students or enthusiasts. They are sponsored by a government MLA or somebody, and they send people across country in a train.
Interesting.
And it's called Jagriti Yatra. You observe the culture, you observe the problems around, you observe the society, you observe everything that you see, and you come up with thoughts, solutions.
Interesting.
So I was thinking,
Correct.
for student, that's an amazing
Absolutely.
thing to do.
Correct.
Take a tour. Everyone wants to travel after this movie. What is that? Zindagi Na Milegi Dobara? No, this is Hrithik Roshan's movie. I don't know whether this is, I think this is the right name.
Okay.
That movie, after that, everyone wants to travel, retire early and travel, right? So, why wait for 40, right?
Now only can
Take the Jagriti Yatra now and observe the problems that are around you. Okay. So, now let's go to this framework. Define, develop, deliver, deploy. This is a good way to understand. Now, in the beginning, you didn't want to be a doctor. It comes to that, eventually you are here helping the doctors. And now you're saying pediatricians are some of the customers. Now, when as a student, I think of medical field, doctors, and if I'm from non-medical background, everything appears to be same. Doctors are all doctors. And then you're saying pediatricians are buying my stethoscope. How do you decide who are you going to sell it to? How are you going to decide who has the problem? What is the problem? So how did you do the first step of defining?
So in defining, normally we will have to do immersion. So in with respect to medical, it is called as clinical immersion.
Okay.
Wherein again you need to get exposed to different types of problems. Who are facing the problem? Is there any willingness to pay if you're solving the problem? When you are understanding and meeting many of these people, you will get a set of, I would say, set of issues or set of problems faced by certain set of I would say stakeholder. And once you get a hint of that, you will have to again use scientific principles to again interview more.
Yeah.
And understand whether the problem is worth solving. There is people will be paying for it and other things. And once you are able to do that, you will be able to price it also. Currently, what is the solution? What is the alternate? If your product doesn't exist, how people are going about today, and what will be the willingness to pay. That all discovery will happen once you are knowing the problem, the stakeholder segments and all.
So you're saying you have to immerse yourself with the context of the user.
Correct.
Wherever the problem prevails, according to you, you said immersion, clinical immersion. In social sciences, we call it ethnographic
Okay. I
methodology
think
of,
different names,
yeah.
same meanings.
And design thinking, we call it empathy.
Empathy.
Empathize. So before you define, you first empathize.
Correct.
Then you define.
Correct.
And then you prototype and test and so on.
Correct.
Yeah, so I think this is something for students to take away. The very first thing when you're looking for a problem or you have broadly identified a problem, be around the users, be around the customers and observe, take notes, immerse yourself in that environment. So let's talk a little bit more in detail. How did you do it? So clinical immersion, what did it mean? Did it mean you going and sitting in the doctor's lab or doctor's office? What did it mean?
Yeah, so I think a lot of I would say the learnings that happened in that phase. So after the hackathon, we joined the lab full time under Professor Ravi. So first one
You joined meaning
as a
you can
researcher,
no, you can choose to join, or you have to go through a selection
yeah, you have to
process.
go through a process, selection process.
Okay.
Yeah, so since we had shown some promise in the hackathon,
Okay.
we got the option to continue further.
Okay.
And that's when Professor Ravi kind of started guiding us how to go about things.
Okay.
And in that, I remember first 2 weeks, since we were all raw engineers, what we knew was just to find the electronic components, connect things, and to show the working prototype.
Right, right. Whatever you know, and you'll put it to use.
That's what we were doing. Professor Ravi made sure we don't touch electronics for first couple of months. He said, close all those things, keep it aside. He said, go and meet doctors.
I see.
He said, go to medical college, go to government hospital, go to different stakeholders, try to understand what you are building. What is the problem? Is it worth solving?
Okay.
That's when me and Tapas, we started what I call approaching hospital. Dr. Rupesh was guiding us
Yeah.
in those process. So we went to good hospitals like the KM hospital, JJ hospital, then Hinduja hospital. We got good time from doctors, top doctors, Dr. Lansford Pinto, then Dr. Nagesh Wagmare, Dr. Anvay Mule. All of these doctors gave us time, and they gave the what I call, I would say, the perspective from them that what are the things which are happening currently which can be done better.
Two questions here. One is, one is observation and a message for students, which is that, when we have a hammer, everything looks like a nail. You are electronic engineer and you will try to solve every problem with that knowledge, electronics, right? So it's amazing that Professor Ravi said, no touching the electronics, go to the field, observe the environment where the problem exists. Wonderful. Second, when you were a student, you were a recent graduate and then you became a researcher there, right? You are going to all these big hospitals. Why would they talk to you? You have no credibility as a student.
Yeah, so that I would say the center helped us, and I think that's where ecosystem also plays.
Yeah.
Doctors are very busy. They have already so many patients to see.
Yeah.
Very difficult for them to even give time to anything else. However, when ecosystem plays its role, meetings are possible, and even I have seen doctors who are very passionately want to talk to engineers.
Yeah.
This is one of the bridging gap that professor was trying to solve, which was he was to tell a joke. Doctors and engineers don't meet often. Either when engineer wants a surgery, or doctor is sending his son or daughter to a engineering college, or he want to build something in his home.
Right.
So
Okay.
we all work in silos.
Yeah.
That's what also need to be broken.
Right.
We all need to break our silos, talk to the other counterpart, and I think now it has become much better. Online groups are there. So many, I think, facilitators are providing it.
Actually, breakthrough innovations happen at the boundaries of disciplines, not within the disciplines.
Exactly. Absolutely. Very spot on point.
Two disciplines have to talk to each other. Okay. Great. So we are defining, and I was asking you, how did you actually define the problem? The answer to that was immersion. To do the immersion, you actually went to the hospitals and interacted with doctors, sat with them, observed them, and you had to get credibility for students. This is a important question. When they have to go out, talk to their potential customer, why will they talk to me? I'm just a student.
Correct.
Once I ask a question which looks stupid, they will say, run away. Students are scared, right? They don't have that confidence, not all of them. So the answer to the question, at least in Adarsh's case, was that the center where he was working, the lab, the professors, that helped. So you associate yourself with a certain local ecosystem or within the university, which has some credibility. You become their part, and then that helps you talk to your potential customers. Okay, that is define. Let's go to next step, which is develop. Tell us about develop. What does it mean?
Yeah. So the end outcome of define is a problem statement.
Yeah. Okay.
And then the functional requirements, and what exactly that functional requirement should do.
Okay.
So develop phase is mainly quickly to build a proof of concept of that.
Okay, I did say next step, but let me bring you back to problem statement. Tell me about problem statement. How did you formulate it? Meaning, is there a template for it? Do you write it in a certain way? And you said functional requirements, which is, quite detailed. So tell us a little bit more and then we'll go to develop.
Sure. So the problem statement is something, how do you define the overall research that you have done and put it in a single sentence which kind of makes what you are going to actually develop,
Yeah.
right? And you will not exactly tell what exactly the thing you are going to develop, but you need to, in a very high level, you need to define what you are going to make. Maybe for example, you will in our case, it was a way to listen to better sounds and way to record and analyze the heart and lung sounds. This was the problem statement for us.
So then you're actually not talking about what you are going to make.
No, you just need to mention the because you'll get biased. If you say I'm going to make a amplifier, then you are biased.
Then you will actually make an amplifier even if the problem doesn't require.
Correct.
Okay.
If there was a better way of amplifying without even electronics,
Yeah.
we will miss those if we are adding solution to the problem statement.
Okay. Okay.
So that was the problem statement.
Okay. What was it in your case?
Yeah, it was a way or a device, or it's even not to add device, a way to listen to better sounds, a way to record the heart and lung sounds. When I say sounds, it's all heart and lungs.
Right.
And a way to analyze the heart and lung sounds.
Okay.
For screening and monitoring the heart and lung diseases.
Heart and lung disease. And when you were going to the clinics, when you were going to hospitals and talking to doctors, were they pediatricians? What kind of doctors were you talking to?
Yeah. So what was mainly happening was the people whom we met, these were specialists.
Okay.
And these were cardiologists.
Okay.
And these were pulmonologists.
Okay.
And the problem which was coming to them was, there are these diseases, cardiac and pulmonary, which are, I would say, not diagnosed at the right time.
Right.
And if it is diagnosed at the right time, the patient will have a very good outcome. So his outcome was, can we build tools which will enable better detection in the tier 3, tier 4 places, or in I would say even the physicians. That was the problem statement that we got.
Okay.
But the end user eventually will be pediatricians and physicians, but the people who told us what is the problem is specialist.
Is a specialist.
Because finally they were the one who were facing the, I would say, facing the repercussion of a delayed detection, and finally they need to do surgery.
So problem was identified or stated by someone else.
Yeah.
And product today is being sold to someone else.
Exactly. That happens.
Isn't that contradicting? How, you go to someone, they say this is the problem. Eventually, when you build the product, you're selling to someone else.
Correct.
Who tells you problem is not actually the customer of the product.
So what basically happens is, when you're going to, let's say, in healthcare specialist, these are the people who see day in, day out these abnormal cases and patients with abnormal conditions, and they ask question why this is happening. And the underlying condition was that if they had come early, then they could have got a better outcome.
Okay.
They're coming in stages when it's very difficult for them to do anything.
Okay.
And many a case, what happens, we rush to hospital only when we are completely sick.
Right.
We are not able to do anything, then only we rush.
Yeah.
And if we are able to get better screening at the first time when we are going to a place, then I can get better diagnosis, I can get better surgery or therapy, versus when it really becomes very big issue, then I'm directly ending up in ICU. That time, these are the doctors who are going and checking.
Right.
And they are telling, oh, you should have come much early.
Right.
Maybe I can give example of congenital heart disease, which I was saying. Many congenital heart diseases are actually discovered when the mother who is about to give birth to his child comes to a hospital, that's when they are able to get to know this woman had a problem from the childhood.
Oh,
This is the case.
see.
Because it was not detected. Even I met someone very recently, last month, working in a very big bank. She was around 26-year-old.
Okay.
She did not know that she had a congenital heart disease.
Okay.
And then she had to operate and things like that. So these are the, the things which, if it is detected early, then the outcome will be better. And who is going to detect early? It is again not the specialist. It is the doctors in, in tier 2, tier 3 places, or even the physician. Because you go to physician first. You don't go to cardiologist for your primary problems.
Okay, I'm worried now.
No need to worry.
So anyone could have this heart disease and they may not know about it.
Correct. They will, the symptoms are shortness of breath, which means, difficulty in breathing, or even, when they're climbing, difficulties. I will not make you conscious. But
Okay.
this exists, and that's why the, the deaths are as well as higher. And again, with that motto, we have our upcoming products to make it possibly to check at home.
I see. So right. So let's go to the second product. So this is the device now that I can buy and keep it at my house.
Correct.
And this connects with stethoscope.
Yeah, if doctor is there, he can listen to those sounds.
Oh, so this is a recorder. So I put it here and record it.
Yeah, you can.
And then I can transmit to the doctor.
Correct.
Through Bluetooth to my phone
Correct.
app to
Correct.
doctor. Or I take it to the doctor and doctor plugs it in and plays the sound and listen to it.
Correct. So one is the sound, but we are adding ECG as well.
ECG to this?
Yes. So it has ECG capabilities.
As good as the normal ECG?
As good as the normal existing machines. The main point is, when we look at heart has two things: electrical activities, then mechanical activities.
Right.
Electrical activity is checked by ECG. Mechanical activity is checked by the sounds.
Okay.
So we are having ECG and phonocardiogram in the same device.
This will also check
electrical activity, which is ECG.
ECG, yeah.
As well as the mechanical activity, which
sound.
is the phono. Yes.
Phono.
So both heart sound, lung sound, as well as ECG, we can get from this device. And this is designed for people at home, above age of, let's say, 50, 55, who are at risk, let's say, having high, lipid profile issues or other comorbidities. They will require, if they're having a symptom, we want them to check first and not neglect, because these diseases are becoming very increasingly killing people's life, and we want to make sure it is screened or it is checked at the early stage and people don't end up dying.
Is this a replacement for ECG?
So existing ECGs are at hospitals or at clinics, which you have a very big machine, it comes up with a printout.
Right.
This is for consumers or small clinics.
I understand that, but is it as effective?
It is as effective, yes.
It gives the same data?
Yes, it gives the same data. So the electronics revolution which has happened.
Then why do we have those ECGs? They cost like what, 5,000 rupees?
1 lakh. My existing is.
Oh, no. I mean, for a consumer, it costs 5,000 rupees.
Yeah.
One time, right? If I get an ECG?
Because the cardiologist is also diagnosing the
that is right.
conditions.
Right.
And
yeah.
It is need not a bit higher.
How much is this for?
So this the retail price, we are finalizing that part.
Okay.
But we'll be giving it on rental also.
Rental.
For patients with cardiac issues.
But this will be much cheaper than the ECG machine.
Yes.
Okay, that's revolutionary.
Yes, and not just this, even we are adding BP machine.
Okay.
We are adding the ring as well as the band which I mentioned.
Let's see the ring.
Yeah.
Okay. Why don't you give a demo?
Sure.
What does it do?
Sure. The ring we have seen already, it is becoming now familiar with wearable market. People are now tracking fitness and things like that. What we are trying to do is, there are data related to sleep, steps, heart rate, which we can track using this technology, which we are adding to existing data available. So we have medical devices like ECG, BP, which can track medical data related to ECG, BP and other things. But there are other data like sleep, steps, heart rate, that we can get from a wearable like this. and it goes very with our lifestyle because I'm wearing this and I can just walk and go anywhere. This has a display. I'll be able to see the number of steps I've taken, number of my heart rate, and my other parameters. Not just that, it also has a trigger, as in if I want to remind the patient for a medication or for doing an exercise or for checking a vital like blood pressure, I can give an indication from the app, and all of this gets connected to the app. App is in multi-language. It enables people to connect to this device, send the data to a doctor, family members to track, and all of this we are launching in next 2 months. The name we are calling it is future care because this is the future of the care.
Okay. And doctors, they accept, I mean, are doctors today open to taking the data from a ring or from this and then actually basing their diagnosis on it?
Yeah, so this is a very important question. I would say currently there are many wearables, fitness trackers claiming as health trackers. That's, I would say, not the right way of putting it because doctors are not going to believe in wearables directly as a raw data. Even FDA also doesn't permit this for tracking the health. It will require a clinical study validation in a hospital, and the CDSCO gives a manufacturing license as a medical device. Those are the data sources what doctors going to rely on. So our medical devices have passed through that regulatory, and these are all certified by the bodies as a medical device. These wearables, this will act as a parameters only, but already we are in a study to make that also part of a medical device.
Okay. So this is not in the market yet.
Not in the market
And
yet.
this is also not in the market.
That we got the manufacturing license. We'll be taking again 2 months. We are planning to launch this.
I see. And it's a ring. So you are making different sizes?
Yes, there are different sizes, and it can go any of the finger, but we prefer for the index finger.
For index finger.
Because the accuracy is much better in this.
Any astrological implications? You can't just be wearing all the. Some people are like that. So can I really put this and it won't, मेरे ग्रह नक्षत्र को तो नहीं छेड़ेगा ये.
If you are scientific, it will not.
But it is stuck to my finger. Can I keep it?
I think we'll reserve one for you surely. Okay. This is paired with my data, so.
Okay, it'll mess up the entire thing. Okay, so I'll try to get it off in the meantime.
No,
don't worry. So where were we? Define, develop, deliver, deploy. And we were defining the problem. And we were saying who would buy. We were saying the problem is faced by someone else. Someone else defines the problem. But now different doctors are buying this product at least, right? The pediatricians. So why are you selling most sales made today of this stethoscope are to pediatricians? Is that correct?
Physicians and pediatricians, both.
Both of them?
Yeah.
Okay. So pediatricians, what is the use case for pediatricians?
Sure. So maybe again, one thing to add, when we were validating the problem, we also met physicians and pediatricians for validation of the problem.
Okay.
And the current pediatricians, the reason they buy is they can get this heart sound as well as lung sound, and they'll be able to listen to these sounds very clearly. And any of the abnormal murmur or crackling sound, they'll be able to listen to it much better. Maybe mainly in cases like pediatricians, the baby heartbeat, it is very fast, like 120 beats per minute, beating very, very fast. If there is any murmur, it is difficult to catch.
Yeah.
So our device enables the detection. That's the reason doctors, pediatricians purchase.
Okay.
For physicians, it is mainly the chest region of some patients will be very thick, and with normal stethoscope, you can't listen to those sounds. Since we are having good enhancement, doctor can amplify those sounds.
Okay.
And the detailing that the doctor can get is fascinating, and that's the reason the physicians purchase.
Okay. Got it. So that's why, for pediatrics, detecting some disease
abnormalities
early on, that's
correct.
Important. And as you said earlier, only when some, females, when they go into labor, when they're having a kid, then it is figured out that they have a heart-related issue.
Correct.
Okay, got it. Let us now jump to the second step. Define develop. So, what is develop? How do you do it? And hardware product, hardware moves very slow. We understand getting the material, and also in India, do we have sufficient in-house capabilities to develop, to manufacture? And then there is all this licensing, approvals, and medical devices, right? So this step is going to be very interesting. Tell us about develop.
Sure. So again, I can again mention hardware is hard.
Yeah.
Not that easy as developing an app.
Yeah.
However, that is again an entry barrier for someone to enter as well. If you are able to make it,
Yeah.
for the competition, it will take more time to refine their product.
Right.
So again, that's where the complementary skill set came in. Tapas was already good at electronics, getting components from across the world. So components like capacitor, resistors, or the sensors. So he knew exactly how to get components like electronics.
Yeah.
And we kind of made our first proof of concept very quickly by adding, the things required only for the functional prototype. As in functional requirements I mentioned. So functional requirement is you are putting what is the functional requirement number 1.
Okay.
What is the functional requirement number 2?
Let us name it.
Sure.
What was number 1?
It was amplification and sound
Amplification of
enhancement.
sound. Okay, let's stick with this now.
Sure.
Okay.
So that was the first
Functional
functional requirement. We just had to make that ready. That's it. Not to worry about the form factor, not to worry about how it will look like. No.
So you said the proof of concept.
Yeah.
Now, the functional requirement in the problem is to amplify the
Enhance the
sound of
hard
heartbeat,
sound, lung
right?
sound. Yeah.
How do you build a proof of concept of this?
Yeah. I would say, if you have learned engineering in second year, third year, amplifiers are taught in our engineering.
Okay.
Like for me, in my case, I had forgotten all those. But you have
You didn't want to become a doctor. Then you did engineering, and then you say you forgot the engineering bit.
So in my engineering, my days were all spent on edX and these kind of forums. So you become more extracurricular than what is told you to learn.
Okay.
But that helped again sometimes.
Okay.
We kind of knew how to build a circuit for amplifier that connects back to the project which me and Tapas were doing.
Okay.
So we were actually building a small robot
Uh-huh.
which can sense and which can move.
Okay.
So we already knew how to sense signals.
I see.
So that learning was there from that project. We made that more, I would say, enhanced version. And that itself, we put it in a box and we wanted to show it to doctor. Again, there is a funny story on that as well.
Okay.
So professor wanted us to make sure we meet customer or potential doctors and get feedback early on,
Right.
not to wait until everything is over. Right?
Very nice. Very
So
nice.
since he was pushing us to do this, Dr. Nambiraj, we asked him whether he is available. He was practicing in a rural hospital that time.
Yeah.
So he said he is available, he is traveling, but he is available in the CST station or called as VT also, Victoria Terminal in Mumbai.
Okay.
So Tapas, we wanted to get feedback about the amplification. So we packed everything and it was very, bulky device.
Yeah.
You might have seen a SMPS converter, which looks like a aluminum, casing and things like that.
Okay.
So we went with that. We went to this CST station. It was a first floor hotel. We were sitting like this, just like this, and doctor was sitting on the other side. Tapas was sitting beside me, and this place was a very interesting place. So Tapas took this big box and he started connecting cables, and people surrounding us became very anxious.
Oh, you're in Bombay.
We were in Bombay, and that's where the
And railway station.
yes, it was a
You're
CT, CST.
plugging wires into a device.
Plugging wires. So the hotel people just started to look, what is going on.
Okay.
That's when Dr. Namiraj realized. Me and Tapas were in a different mindset. We were like, let's get the feedback about this.
Yeah.
So Dr. Namiraj realized. So what he did, he had a stet. He took the stet and he, showed
Started
that
checking.
he's a doctor and nothing explosive going to happen here. So that gave us an insight
Okay.
that the look and feel of a medical device,
Yeah.
you can't drastically make something different.
Okay.
So that again we went and validated. So all of that learning finally we made in this form factor,
Yeah.
so that it goes to existing stethoscope without changing the look and feel. So I would say every interaction with the customer that time gave us one more insights, and we build on top of it.
Now, I think that's great learning. In the class, we teach this lean startup methodology: build, measure, learn, right?
Yeah.
Build something, go to customer, measure the feedback, learn from it, and then rebuild. So that's something in hardware, it's absolutely more essential.
Correct.
Because you have to spend money on this.
Correct.
If it is software, then you're coding, that's your time that you're investing.
Correct.
You know, although that's also precious, but as a student, you have that a lot.
Correct.
But what you don't have as a student is money and resources, access to labs.
Correct.
You know, making a hardware product is much more difficult. Therefore, it's all the more important that you talk to customers and you build what they want.
Correct.
You build something which will sort of functionally solve the problem.
Correct.
And now that you've said, look and feel also
Correct.
At some point becomes important.
Correct.
I want to distinguish different forms of products. When you begin developing a hardware product specifically, you said POC,
Correct.
you said prototype,
Yes.
you said functional prototype,
Correct.
and then, you know, I'm sure product in another word.
Beta version.
Beta version and
Yeah.
so on.
Yeah.
Let's distinguish. And my question, which I don't know whether it got answered, how did you make the POC? What does a POC mean when my problem statement is that I want to amplify the heart sound? So what is the POC in this case?
Sure. So the POC in that is the matching the functional requirement, the functional requirement which I mentioned,
Right.
where you define exactly by how much you want to enhance,
Right.
and you just make that particular thing.
Okay.
You don't do more than that.
So when you say make that particular thing, the thing is vague. Now, thing could be a very well finished. What was it in your case? What did you build?
Yeah, it was just what is the minimum thing required to make that possible. For us, it was a breadboard. There is something called as breadboard, and there is pref board. We made that in breadboard first. Breadboard, I think all electronics engineers will know, wherein you put all components and make a circuit.
Right.
And then next is the pref board, where it is more stable. You can solder and things like that.
Yeah.
So that was the more stable one, and we had some noise related issues in the breadboard. So we went with that. That was the unit, what we put it in a SMPS box, and we went for the feedback. So proof of concept is just minimal thing that you can match and show that your functional requirement you are able to validate, or you are able to show that you have built that part.
So I would say, it's a sound and you have to amplify it.
Correct.
How hard is it? Amplifiers are there, sound amplifiers, right? They're already there.
Correct.
So what is different in this case? What did you have to worry about in the POC? POC, I mean, the way I understand this is you're not worried about the fidelity of the product a lot.
Correct.
You are focused on proving that you can amplify.
Again, maybe I can rephrase, instead of amplify, I'll put it as enhance.
Enhance. What is the difference?
Difference is when we are amplifying, you are amplifying all the sound which is coming out. But when you are enhancing the particular frequency of sound, and you are reducing the other frequency sounds.
Okay.
So in this case,
this is the functional requirement.
It's a functional.
See how meticulously you have to define it.
Absolutely.
Okay.
Absolutely.
Right.
And if I recollect again, heart sounds are up to around 400 hertz.
Okay.
Then lung sounds are up to 1000 hertz.
Okay.
And our speech is normally at 4 kilohertz and above around 6 kilohertz for female voice.
Okay.
So if a doctor is placing the stent, he don't want to listen people speaking in the background, right? He need to listen to only the heart sound or only the lung sound. So the signal of interest is the heart sound and the lung sound, not what people are speaking, which means we will have to amplify the heart sound and lung sound and reduce the other sounds. So this is the enhancement functional requirement for the first part.
I see. I recently heard about one of the leading tech companies having built a quiet room where you enter and you can hear the sounds coming from inside your body. And nobody can stay there for more than a few minutes.
Interesting.
It's crazy. You're hearing what you're...
I think we'll go mad.
Yeah. Okay, coming back to this. So proof of concept, basically a scientific validation that something which can solve this problem, in this case enhancing the sound, it can be built. So a breadboard, uh,
And prep board, yeah.
pref board, and using that you build something. Great. So that is POC. What is the next version of the product?
So next is once you are getting that, okay, the sound is good, good enough for doctor to use or a company to, give money and manufacture, right? That's when we refine that further and make it in a form factor, not fully polished, but good enough to be used in a daily practice.
So now you are building usability into it.
Yeah.
Okay. So, and you said form. Form means look and feel,
Look and feel.
packaging, right?
Yeah,
So,
correct.
if this small box was a big box, then you can't use it in a clinic. If
Absolutely.
you make it compact enough, then the doctor can use it on the patients now.
Correct.
Okay.
In fact, maybe to add, the first couple of recordings which we ever done, that was all with very big, devices for us just to see the proof of concept is correct.
Right.
To see all kinds of normal, abnormal sounds we are able to capture.
Okay.
Once we got the confidence, then only we went with the refining of the look and feel.
Okay. So how many versions? So look and feel, the form and usability, you built it. Then you also said product and then beta and so on. So were there more versions in the hardware product?
Yeah,
you're
I mean,
building?
it was like maybe around 15 to 16 versions.
15 to 16 versions.
Yes.
And every version means you have to build it from scratch, or you can use some part of
Yeah, you can enhance it. But again, for hardware, and that's a difficult part, wherein again you will have to have a different, the PCB and different casing and things like that. But I would say once you are able to go to one level,
Yeah.
then all the learnings are there.
Yeah.
You just know what small thing you missed or how something can be better. That iteration will be much faster. But getting to the first proof of concept is the toughest part.
Right. And as someone who is not in the medical field, example, earlier you said, as an engineer, you would have not thought about making a medical device. And for students to open their mind and think that, yeah, I'm an engineer, but I can solve a problem in any field using engineering. Likewise, I'm a medical student, I'm a management student, or whatever you are studying. Using that knowledge, you can solve the problem in any other field. You have to use what you know, and you have to build a complementary team, and then you get the support. And in your case, you went to a lab and you got all the support. Hardware is hard. You have to get the supplies. You had to have a physical space to develop the product, and you had 15 different versions of the product, right? So where did you build this? And when building a hardware product, of course you were an engineer, but medical information also has to come in. So talk about where did you build it, how did you get material, and then talk a little bit more about Professor Namiraj's role in this team. Yeah.
Sure. So I think there, I would say Professor Ravi and Dr. Rupesh played a huge role. Both of them come from a mechanical background.
Dr. Rupesh?
Dr. Rupesh as well as Professor
Ravi, yeah.
Professor Ravi.
Dr. Rupesh is a faculty or a medical doctor?
Dr. Rupesh is a faculty.
Okay, both in IIT Bombay.
Both in IIT Bombay.
Okay.
Professor Ravi is was institute chair professor. Currently, he is the dean at NIT Surathkal.
Okay.
So they helped us and guided us to move from one version to another much faster.
Okay.
Because they know how to build a mold.
Okay.
They know how to build a mechanical, things.
Right.
And their insight helped us. Again, we had a mechanical person in the team as well.
Yeah.
And along with that, we had support from IDC. IDC is the design school in IIT Bombay. If engineers only design, it will look very bad, I promise. And that's where the complementary skill again need to come in.
Yeah.
So professors from IDC came in, multiple professors I can mention, and they gave us ideas. They even gave their students. One of the students is working with us till now.
Okay.
Yeah, the one who made the first version is with us. Yeah. So is Ram Kumar, and he was assigned as doing his internship project.
Right.
That time.
Okay.
And he helped us saying, if you're making small form factor like this, holding like this, and he again made multiple versions, color, texture, and the shape and everything. We went and asked a lot of doctors. Out of all of those, we finally came up with this.
Okay.
So it was again, I would say, ecosystem played, complementary skill set played.
Yeah.
I think I've seen many people who are solving problems. Let's say I've seen software engineers trying to build hardware products.
Right.
Their app UI looks fantastic. The hardware looks really bad. The reason is they have not added someone complementary
Correct.
in their team. And otherwise also I've seen mechanical team building software products. UI looks very bad. So you will need a team member who knows that.
Isn't it so difficult to work with a team? As a student, I've just learned to read my books, appear in the exams, prepare on my own, right? Teachers teaches me, parents help me, fine. Everyone is focused on me. But when I have a team, there are team dynamics, there is, right, there is competition, there are conflicts, there are disagreements. How do you learn as a student to navigate through all of this?
Yeah, I mean, I think team, you should not criticize the person always. You should criticize the thing or the, the work, right? And not getting into, the politics and things like that. That will really ruin the whole team.
Yeah.
And I think even maybe mentors can play a very big role.
Okay.
Faculty members can play a very big role. They can kind of, navigate this, some leader in the team who is trying to make something work and he will not know for sure how to navigate things. Maybe mentors can help. For us, we had a good chemistry. I had good understanding with Tapas.
Yeah.
And we were all good in our stuff. And I would say the environment was so conducive and good. You are trying to make sure you go to the next milestone.
Yeah.
And again, if you emphasize the milestone and bring that as a goal point,
Yeah.
and if everyone is passionate to move there, then these small things can, fade away.
Yeah.
So I think mentor can play that role to make sure the milestone has the goal and, people moving towards that.
How do you decide who's the leader?
So in this, we had the leadership role in depending on different phases. Until we were developing the hardware, it was Tapas. And once the hardware was made for the software and the embedded and the signal processing part, I had to chip in and do something on that. I had some software background as well. And once that was done, then we had to write proposal to government. BIG grant we got.
Okay.
50 lakhs of money.
Okay.
And during that time, out of 3, Dr. Rupesh mentioned, Adarsh, you can, if you're interested, you can take this role. And that's when I also, got the opportunity and started learning about entrepreneurship.
Okay.
And that's when the transition from product to company began. And that happened naturally for us.
Okay.
I don't know in other teams, but for us, there was not a friction or anything.
Okay.
It was very smooth.
So you had everything, in your startup, medical, engineering, then you said chemistry.
No, chemistry.
Chemistry among the team.
People.
Chemistry among the team members. That's also very important other than the engineering and
I mean, you will need people skill as well.
yeah.
So you'll need to know motivating people and bringing people together. It's very important also, I guess.
Okay, let me pull you back into, we are going through this 4-phase journey of a hardware product, right? Which the approach that you learned at IIT Bombay. Define, develop, deliver, deploy.
Correct.
We've done define, we are doing development, and then we took a digression. So is there more you want to tell us on development? How do you reach the final product, the certification, the licenses, the difficulties in getting them?
Sure.
Talk about
So certification or regulation in healthcare starts from the problem statement, from the discovery of problem.
Okay.
It won't start in the development phase much early than that. And you will have to document every single conversation, every single requirement, every single proof of concept that you are doing. Now, the framework is more mature in India. And once you are moving from the prototype to product, you will have to pass multiple tests.
Yeah.
Then you will have to register yourself, as a, in the registry of CDSCO.
Yeah.
You will have to get as a test device. And there is a process, and I think especially for medical device, it requires a good incubation center or good guidance. Without that, it will be very difficult. So, but I think now the incubators are also playing the role. As far as Betic played the role of documenting and navigating us, you require ISO 13485.
Yeah.
So, and it requires a lot of files,
Yeah.
a lot of things. So they provided us the supporting mechanism, and we navigated quite smoothly with that.
So, what kind of support do you need when filing all of this? Of course, as students, you don't know, and when you start, you don't know you're building a venture, right? It's just some innovation, something that excites you, and then you have to learn about all this licensing and paperwork and processes and ISO certifications, this that. So, did you take some help of consultants, or who educated you on all of this?
Yeah, so these consultants were available in the in the BETIC IIT Bombay,
Okay.
and even I think people can get consultants outside also
Hmm.
for regulatory. What are the risk of the product? How do you classify the product into what category? How do you go through the what you call process of getting the manufacturing license and all those things? Again, it is the field in itself. Either you have someone complementary, but I think you can get consultants. That is more better because unless you are building multiple products, you can go and get a consultant or ecosystem player to help.
Right. And where did you get the money?
Yeah, so that's also crucial question. You are in hardware, you are doing a lot of research, you need equipments to test, equipments to build,
Yeah.
you will need your prototyping money. For us again, the ecosystem played for us in the beginning. Now also I am seeing there is a lot of programs from DBT, DST, EAR, Nidhi Prayas.
You got the BIG grant, right?
We got the BIG grant.
Uh-huh.
We got Nidhi as well. And again, now ecosystem is very mature.
Okay.
I would say very fortunate that we are living in this time. Maybe I think 20 years ago it would be very difficult.
Right.
And now I would say there is a lot of push on from the ecosystem to educate, to make sure you are hand holded in each step, and you can get fellowship,
Yeah.
EIR and all those things, and even they will navigate.
What was your primary source?
For us, it was in the beginning, it was BETIC. So we were researchers there, so all the development till 2017 was in BETIC.
So was your project, it was a project, right?
It was a project.
And it was led by a faculty.
Yeah, it was led by faculty, and the motivation of the project was to develop medical products.
So Professor B. Ravi and Dr. Rupesh, they were the faculty.
Yeah.
And they had this problem statement?
No, not to this device. Again, I would say it's a ecosystem which made this center itself possible.
Yeah.
So Professor B. Ravi is a mechanical engineer. He faced similar problem of, or he got into the system wherein he met a doctor who is an orthopedic surgeon. He was developing a knee implant, and it was failing multiple times because it was all imported. And they got together and made a project, approval from Department of Science and Technology, I guess. Once that was done, Professor B. Ravi got his thing that why don't we have a center wherein people can come and develop medical technologies.
I see.
So that's when this center was established, wherein the whole objective of the center was to enable entrepreneurs like us to get the research problem, do the clinical immersion, go through the process. When it is really ready, then to go to the what I call incubation centers. So that was the pipeline, and the aim for Professor V was around 10 products, 10 startups. Eventually, they ended up doing, I think, 20 startups, something like that.
Okay.
So I would say huge, contribution from the center, and more of these centers are actually required to make sure this revolution of health tech that is possible. I think more of that work needs to be done.
So then for this specific problem you were working on,
Correct.
it was not that you had specific money pool allocated
Not
to
for
you.
that.
The lab had the
Lab
money.
had the money, yes.
And they had the agenda to do
Correct.
it, and resources would
Correct,
flow.
correct.
Yeah. So get into an ecosystem.
Yeah.
That's right. And today
In
government
healthcare, it's
in healthcare, in hardware, all the more important, you need access to equipment, intellectual capital of researchers, faculty, lab, that ecosystem, and for credibility, as I said earlier. Yeah, thanks to the government, several programs, agencies like DST, BIRAC, Atal Innovation Mission, all these agencies are doing great work in providing the much needed, seed capital for such ideas to flourish. Okay, so we've done define and develop. Let's go to deliver. The third step. What is deliver?
So delivering is something uh, you make the good version of the product and get it to the hands of the users and try to see how the product is helping people to solve the problem. And I would say you try to see how much you'll be able to make the product in the life of the user.
Yeah.
So that journey happens in that phase. And for us, it was we made the device and we gave it to doctors in Hindus Hospital, in Fortis Hospital, and in KEM and JJ Hospital. And we tried to understand what better we can do, what enhancement is required before it goes to the final version.
So deliver means what are you delivering? A product or a prototype?
So it's, I would say, a beta version of the product.
Okay.
Good enough that can be used and good enough to get your conviction that you can actually plan for your next version or next launch.
So minimum viable product.
Yeah, exactly. That is will happen there. Yeah.
Another terminology that we use in lean startup
Lean startup,
methodology. Something which is ready for the users to use it under actual circumstances.
Correct.
Right? In the real environment. That is the version that you deliver. Are you charging for it?
Yeah. So it happens in two ways. You can, like, we parallelly was one more thread I can mention. So I was mentioning the hackathon, right? So actually in the hackathon, problem statement was given by a telemedicine company called YOLO Health. What they were doing was, you have seen ATMs. There are health ATMs wherein a machine is kept in rural places with a nurse and patient comes to that machine. In ATM you get money. Here your health is taken, I mean the parameters are taken and sent to the doctor. So this company had given the problem statement there that they want a device to get the sound and transfer it to a remote doctor.
Okay.
So we made this device and actually sold to this company that day.
Okay, I see.
And to doctors, I would say again it required even more refinement for the expectation, but it was good enough for the telemedicine use case because telemedicine existingly there was nothing. There was no way to transfer sounds. At least you are giving a product which can help in transferring sounds. So that gave us the early traction also.
Yeah.
We could start getting some advance payment through that. From doctors, we wanted to get credibility about the sound quality and things like that.
Yeah.
So the doctor journey went for a long time, but for the commercialization in the telemedicine B2B segment cracked first.
Okay, okay. So some people would pay for it depending on the circumstances.
Correct.
Right? But when you are delivering, do you have multiple products by now?
So we kind of narrow down what are the, again, functional requirements, and we try to see what is the, what you call minimum features you require and what are the advanced feature you require.
Right.
So in cases of this telemedicine company, they wanted to record and transfer the sounds. Even in some doctor's case, they wanted to record the sound. So we had two versions. First version was just to amplify. Second version was to record and you can transfer the sounds.
Yeah.
So like this, we had two versions which we made, and we tried to get the feedback of both these versions simultaneously.
Okay. But how many copies of the product? How many units of the product? I mean, if you have to do a beta, do you need 10 pieces? Do you need 20, 50? How much is enough to validate whether it is reliable? Whether different customers are giving you, same feedback, the product is good, and then you go for the market launch?
Yeah, for us, it was around 20 units.
Okay.
We had made 20 units. Again, 20, I would say units after testing we qualified is good enough to go to the user.
Okay.
So before that, again, the number is, you plan for 20 means you actually make more than that. You consider some wastages that will happen to the PCBs or the casings and all.
Right.
And finally, we ended up making 20 units and we started getting feedbacks and responses from these 20 units.
What kind of wastage happens?
Wastage as in you make, let's say a casing, you give it to the vendor, but it doesn't fit at the end. You're integrating PCB, mechanical, sensors. So after assembling everything, you'll come to know that sound is very bad because of some alignment issue.
Hmm.
So then, but you can't give that to the user.
Hmm.
It should be at a certain quality that you can test. Otherwise, your whole hypothesis itself will be going wrong. So
Okay.
we started actually around 40 units, but we ended up a lot of wastages. We got 20, which was fine. That 20, what we gave it for the feedback.
So from define to deliver, till this time you had 40 units, you're saying.
Yeah,
So throughout this time you are in the lab
correct,
in NIT Bombay.
correct.
And how much time has passed by? You joined in 2015.
2015.
2015, 2014 you graduated.
Yeah.
1 year you worked in L&T.
Correct.
And then you joined this lab.
Correct.
Okay. So how much time did you spend in define stage?
Yeah. So each stage typically from 4 to 5 months.
4 to 5 months.
Yeah.
So each stage equally?
No. I mean, on an average, I can say.
Okay.
For us, define stage started somewhere in 2016 January.
Okay.
And 4 to 5 months we met multiple doctors and got to some idea. Okay, this is what is required.
Right.
And then next, again 4 to 5 months we spent on developing the different proof of concepts, getting the iterations of that. And then by next 4 to 5 months we had the the version of the product going for getting feedbacks from doctors. And that's when we got to know about BIG. And we also in BIG it also requires that you should do some groundwork
Right.
before you
Yeah, it has
apply
to be.
for the grant.
It has to be at certain minimum level.
At some
Because amount is also bigger, 50 lakh.
50 lakhs, yes.
Yeah.
And by that time you have to meet a lot of users, and you should also get conviction.
Right.
Again, it's your time that you're spending next couple of years for this, right?
Right.
So that's when we applied for these grants, and meanwhile we got one support from DST. It was Indo-Swiss Innovation Program.
Okay.
So we were winner there also.
Oh, wonderful.
Got some pilot money and things like that.
I see.
So with all this thing that we moved from product to interesting, the interest from the feedback, the users, and then to grants, and then to get some initial money, conviction to form a company. That's when 2017 we registered the company.
Okay.
And first 6 months not much thing happened. We were waiting for all formal process. 2018 we joined. We incubated in Sign.
Okay.
So that's when like all Sign ecosystem, Poinime and Prasad sir all chipped in.
Got it.
Incubation.
Yeah, I want to talk about that, but I want to zoom into some of these ideas,
Sure.
some of your journey during 2017. But we haven't finished the final stage. So deliver is what we discussed. 2017 you registered, and you had already delivered before you got into the incubation center, right? And all of this till these 3 phases is happening in the lab only. And 2017 you are registering a company.
Correct.
And you're saying we. Now it's a lab.
Correct.
Led by a couple of faculty are there. Right. They've helped a lot.
Yes.
And then there is you and Tapas and Professor Nambiraj.
Yeah.
He of course was a doctor. He was based in Bombay.
Yeah, he was a doctor based in Bombay. Yes.
In Bombay. So he worked with you. Now registering a company, you need to know who are the shareholders.
Correct.
Right? Who will be the founders.
Correct.
So who are the founders? Who were the founders? Who became directors of the company? And how did you decide who will be who?
Sure. So again, it's a very, very, very important question. So I would say there is a difference between product and then a venture.
Okay.
Or a company. Product, the way to give credit to the product, all the people who are involved is through the IP, which is a patent.
Okay.
So we fortunate to get the patent granted, protected in more than 40 plus countries.
Okay.
And all the people who are involved in the product development are part of the patent.
Okay.
So Professor B. Ravi, Dr. Rupesh made sure the enough credit is given to the people who are involved in the development. And that is part of the product. Then when it is going for company, that will require full-time effort from at least set of people. And again, whatever expertise you are getting, that you will still require some handholding until initial years of time. So that's when out of me and Tapas, Tapas is someone who is very tech savvy. When he sees electronics, he'll get very excited, and he just goes to see what is it made of, how is it made,
Yeah.
and kind of a thing. And I am kind of for the long haul and looking to solve the problem till the end. And Dr. Rupesh and Professor Ravi got this very early, and they kind of suggested me also to take the path of the CEO and full-time founder.
Okay.
And again, they guided us in navigating this. Wherein Professor and Dr. Rupesh, they acted as a mentor and advisor for this, and I gave as came to sign as a full-time founder of this.
Okay.
And Tapas, Dr. Rupesh, they acted as a
Mentor.
I would say part-time co-founder there.
Okay.
But I would say their advice was required, and again it it required someone to go full all in and form a team and evolve from there, have multiple products and understand the go to market plan, and then to go for investment raising and all those things. So that required a different thinking hat. Here in lab, only heart and lung sounds are not enough for the country.
Yeah.
So they were getting interest from from surgeons
Yeah.
and cardiac surgeons, pulmonologists, and all
Right.
for multiple problems. So we kind of decided it's of the interest of everyone that I will go full time, and they'll continue innovating in the lab.
When you entered the lab, did you go there? Was the agenda clear that you want to become an entrepreneur, or you went? Why did you go to the lab?
Yeah,
Did you have the
yeah.
clarity
For me, I was sure that we'll form a company out of this.
when you entered?
Yes. So the reason was again when I'm kind of passionate in solving problems, real problems. Healthcare was not the first thing that happened when Tapas showed me the the documentary. But once it happened, I became more passionate that finally it need to come out and become a venture and solve multiple problems in this area. Uh, Whereas Tapas again was a tech enthusiast, want to contribute in terms of multiple technologies. That was very clear. And even I remember the day when we went to the hackathon, I had mentioned to Tapas, the best outcome for us will be to form a venture after this. And he was saying, no, I mean, don't think all those things. I'm a very optimist. He's a very realist.
Okay.
So somehow it had happened. I mean,
He's not full time in the venture.
no, he's still in the lab in IIT lab.
Oh, he works with the lab only.
Yeah, correct.
Oh, I see. So commercials.
Yeah,
So faculty, of course.
Correct.
Without their hand holding, you won't be able to do it. The lab, right? And Tapas, of course, he was a person on
Absolutely.
the tech. And you are the one who are now building the venture. So you get the most commercial benefit as well when it comes to shareholding distribution, right?
correct.
So who will have how much? How do you take such decisions?
Yeah, so in the very early time, again, we had not done much of a discussion on that, and we had gone almost all equal.
Yeah.
And that was
Typically, that's what it happened. 4 friends, 25 each. Yeah.
that's how it had happened that
Yeah.
time. And as things evolved, then when it decided, we have to now raise funds and things like that. So that time we had to do the what do you call the the transactions such a way that they continue to have the benefit of the upside when we are growing, as well as for someone who is coming as an investor, they see there is enough capital or enough equity in the company working on it, and that's why we had to do the realignment of the the cap table that time. Once we came out and we started investment fundraising.
So disclose as much as you can, but I want to know, as the full-time founder, you would take the majority equity or significant amount of equity?
Yeah, so again it got evolved again. So in the beginning it was almost all equal, but I had a slightly higher, again suggested by the mentors and Dr. Rupesh and Professor Ravi. And once it was decided as a full-time for me, and when the maturity of the company also happened, then again there are maths which a VC works out as well.
I see.
For a full-time person, how much you should have minimum, and they also want to see the full-time person having skin in the game.
Right.
Otherwise, they'll see there is
Yeah.
not enough motivation and things like
Right.
that. So we had to, kind of, balance those.
So not only it was not only you, the ecosystem also nudged then. When investors come in, they also want to make sure that you as full-time founder are properly motivated.
Correct.
If you are doing heavy lifting now, building the venture, of course, building the technology was also important,
Absolutely.
but now taking that to market. So you rewarded, you people together, the team decided to reward everyone involved in product development by IP.
Correct.
Now taking this product to the venture is a new initiative.
Correct.
For that, somebody who is full time, they should have majority, and other people who are advising technology, staying away, they would have smaller portions, right? And then the investor would also nudge it. So it's not something that day one.
Absolutely.
It evolves. You learn from the ecosystem. You learn from other players that come in from time to time.
Absolutely.
Yeah. Okay, great. So define, develop, deliver, and 2017 May, and now you're going into the incubation center.
2018.
2018.
Yeah.
And deploy. I'm guessing this is where deployment comes in.
Correct. Exactly.
What is deploy, and tell us more about it.
Yeah. So till that stage, mainly we were focusing about how do you make the development of the device, get feedbacks and things like that. And when you really go and deploy, you need to know how the marketing needs to happen, how the sales need to happen, how the support need to work out, the structure, formal structure, because you are getting money from someone for the product that you are selling.
Right. Yeah.
So if again, if someone is giving money, you are again liable for multiple things.
Yeah.
So you need to have a structure, you need to have regulatory and everything. That's where the deploy things come in, wherein you are sustainably scalably you are able to generate leads, and then convert that and nurture that into sales, and then build a team around it, make support as a function, and solve the issues whatever comes, and then you make this cycle running.
You say this as if it is so easy, okay? You've named 10 different things within scaling up. Let us detail this out. How did you do it?
Sure.
Building all these processes, building a team, selling, taking it to market. Tell us about it.
Sure. So again, it was again a learning. We made the product. We had got the funds, and first couple of sales happened, and it was not moving further. And it was like month 1, now month 2. And I'm looking like why people are not buying. So when that happened, I kind of got into the learning about how do you market, how do you sell a medical product. Even at that time, my understanding was sales and marketing is all same. What is the difference? That was the understanding. And even for people who had purchased, they asked me invoice, and we had GST. However, there was no formal way. I opened what I call Google Docs. I found some template and I pasted. I put the GST and I sent them. There was no process, so it was all, I would say, ad hoc.
Okay.
And then a lot of frameworks that I also had to learn, and again Sign also helped us in some way to formalize the sales process, formalize the marketing part. We were introduced to the marketing consultants from the Sign.
Yeah.
Parthasarthi sir, I would say.
Oh, I met him.
I met him.
I met him. He, I think, visited once, or we spoke on the phone. Yeah. Okay.
Okay, so he's again contributed. Not only us, many companies, all of them are now doing good in revenue. So all of us coming from tech background, he made us go through the context of marketing, selling, and things like that.
Tell us the difference. What did you think was sales and marketing? You thought it was same, but what is the difference?
Yeah. So marketing is, I would say, in my view, again, communicating the solution or the need that is there. Either some people know that they have a problem, some people will not know that they have a problem. If they know that they have a problem, you need to show that there is something like this which exist.
Okay.
And for people who don't know, you need to again know that there there is a problem like this. And if they were not aware, you need to create awareness about it. And till from there, then the brand and all those things, till you nurture and make the lead, in sales we call warm, cold, warm, hot kind of a category. So until you make it warm,
Okay.
that is part of marketing. And then again, marketing doesn't actually end there. It continues till you get referrals and things like that. But sales kicks in once you are getting the leads from the marketing qualified leads. Your sales team, your sales pitch, what is the time to convert a lead, what is the pricing strategy, what is the, I mean, all of this you should have worked out much earlier. But again, I think I might not be putting everything in a proper sequence, but it all happened in parallel actually.
Okay.
So then sales, you have a sales team, you know that each person, his main job is to get the leads and call the people or go and do demos and then get the conversion done.
Conversion, right.
And the marketing role is to make sure from the beginning till the leads are reached. So and then once closure is done, then the CSS, I mean the customer success team, need to kick in,
Customer success team.
which needs to So I think in entrepreneur being a good part is everything that happens in the world in terms of business, you will know end to end, and you will know by experience, you will know by what you call on ground,
On the ground.
on
Getting
the
your
ground,
hands dirty.
hands dirty. And sometimes it is the other way, wherein you do something and you'll be like, shit, is it the way of doing it? Then you go and see YouTube
Then
and
you
other
change it.
place.
Yeah.
Then, but at the end you will learn,
Yeah.
and you will not be knowing everything in the beginning.
Right.
Every 3-4 months, I would say you should be uncomfortable. You should be. If you are not, you are not growing. And when you are uncomfortable, it is mainly you are going to the next stage.
Yeah. Yeah. Great. So yeah, sales is mostly about converting the warm leads, hot leads into cash
Yeah.
with you, and marketing is everything before it, which starts from discovering the customer, making the customer aware that the product exists,
Messaging, communication,
messaging,
segmentation, all the
pricing.
pricing.
Yeah, yeah.
All.
So all that arsenal that is required for you to reach the customer, where now they have to decide whether it is for them or no,
Correct.
and then you go there and push them over the cliff a little bit, and then they
I would say maybe not a cliff, a better place, better better way of doing things.
helping them take the decision.
Yeah.
Okay, done. Yeah, so we zoomed in only into this one marketing and sale bit, but you said a lot of things in the final step, which is deploy, basically scaling it, building a business around it, having a team, having an office, and then this entire sale funnel, converting it. So those 4 steps, amazing. I think that was a very good way to understand your journey. Let me now go to some other questions which are there around the entrepreneurship journey. Uh, how would you measure the success? At what point in time do you consider yourself successful now?
Maybe on a relative scale.
Of course, it's relative.
But
Everything's relative.
yeah, I mean, ambitions are more so.
At what point in this journey? It's very interesting. You in the beginning said, I went there to become an entrepreneur. I knew we'll build a venture out of it. At what point in time you thought, great turning point, this is a breakthrough? What were those points?
Yeah, I think turning points, I would say, when when we could sell our first product to the first customer, which was YOLO Health.
Okay.
And because when someone is willing to pay for the product that you have made, that means there is demand, and that's a huge turning point. I would say even before that, the turning point is I would say getting that you being a engineer can actually solve the medical problems
Okay.
through the process, and you can actually save lives.
Yeah.
That unlock is a bigger. It's like finding your ikigai for me.
Ah, okay.
So that I think that's now actually is a lifelong mission. I mean mission for me.
Okay.
That I would get excited about finding a new problem in again in the same space. Okay, this disease now is done. Now what about bigger disease? That is what gets excited. That framework, getting that part was very crucial.
Yeah.
And then getting the sale, and then winning BIG, winning the Indo-Swiss event, winning Indo Innovation Growth Program, winning all this is on the side. But the bigger turning points are those when when your thinking process changes.
Thinking process changes.
There I would say I would like to give full credit to Professor B. Ravi and Dr. Rupesh. They acted as the best mentor I can get.
Okay.
And now, till now they are my best guru.
How frequently you talk to them?
I talk them very often. Talk with them, and it's very fortunate that I got someone like that.
You did a big fundraise.
Yeah.
Can we
Yeah.
the numbers?
Sure. So what happened once we launched our product, we started selling to telemedicine companies. Then we refined further, and we started selling to doctors. That's when we got opportunity to present our innovation in Shark Tank. So in Shark Tank we got the offer from Namita, got from Piyush as well, and that created good good awareness.
2023.
2023 it aired.
Okay.
And when that was happening, we kind of had our good product ready in the market.
Yeah.
It created a very good buzz for us. Doctors wherever we see, in conference when I'm there, they used to see that I have seen you somewhere.
Okay.
And then I should tell them, is it like Shark Tank or something? They're like, yes. And they used to take selfie and all, and they used to even pass on the message to their friends.
Okay.
That created good interest. When that was happening, meanwhile, we planned to do a proper fundraise. That's when we got introduced to the current, investor, that is Enrichon Capital Inc. Is a Japanese VC.
Okay.
They were introduced by our incubator Sign.
Okay.
And we had initial meetings, and we in parallel was having a collaboration with a Japanese MNC. Murata is the MNC, and I should give good credit to them. They were also supporting from 2020 itself in developing the second product.
Oh, I see.
So it's a
So they funded the
development
earlier,
yeah.
and then they invested.
No. So there are two entities. The Murata is a bigger company, like as equivalent as Sony, and they helped us in developing the product.
Okay.
The Japanese investor who came in, they came for as an investor, putting money and getting the equity.
So the earlier one was just a grant. They had
No,
financially, or
it's a collaboration development agreement that we have done, wherein the product is co-developed product.
okay. How did they help? What did they contribute?
They contributed by providing the technical part also from the Japanese engineers, as well as providing the development fund, a part of the development fund, for the development of this. Again, because we were out of the lab, again the question what they asked was, Mr. Ragesh Menon is the one. He came and he just asked Adarsh, if we had enough money, what would you like to build? This is what he asked me. And I said, sound is one part. We want to add more information so that actually we can detect cardiac issues. And this project we made it, and we presented to the Murata management. They approved, and that's when we started the development of that.
Okay. How much money did you raise with the VC?
So with the VC, we raised around $2 million. Enrichon Capital Inc., very good VC, prominently working. Mainly they are helping Japanese investors coming into Indian ecosystem.
I asked you what were the points when you felt you were successful. You didn't say this fundraise. 2 million is about 16 crores.
Yeah. So I mean, I would say it is it's a success, absolutely. But again, the milestone is not to get the funding and then just be there like that. You are in a journey wherein you have taken someone's money. You should have good, I would say, accountability for it, and you have committed about a progress and your growth. to someone who has actually put money. And putting someone's money is not that easy, right? So someone when has put money out of your conviction, the real success comes when you are able to give good exit to that investor, when you're able to give good what you call return for the investor who have believed you, who have backed you. I think maybe when we go for IPO, again I'm very ambitious, so when we go for that, that's when if I'm able to give good exit to my investor, I'll be, that is my real success that I can count.
How far is the IPO?
So I am looking at a timeline of 4 to 5 years.
Okay.
It will be challenging for sure. We have come from having nothing to this place. So from here, it won't be an easy journey. However, I think we'll be able to do that, through our hard work that we are doing. And we have learned how to develop a medical product, how to take it to market through the first product. Now the journey is more, I would say, simpler compared to that one. Now we know exactly how we understand each and every component.
Are you able to manufacture this in-house
Yes,
now?
yes, it is fully in-house, made in India product.
Oh,
And
components you are sourcing from outside?
yeah, components. I mean, no one makes microcontrollers or capacitor or resistor in India.
Okay.
These all are made in outside India only.
Okay.
So, but what you are putting in is your design, your logic, the embedded software, the code that you are putting in, and the AI that you are developing. That is all fully here, and we do the PCB fabrication in India. We do the assembly of components, and then the final testing. Everything happens in India. And once you are able to do that, learning is huge. We have gone through that journey once. Then now the next journey is how do we scale, how do we capture bigger market, and that's when we broadened our vision for reaching to every home, to make sure, again, the confidence that I got, now doctors are using the product for a purpose. Can we now really go to every home and make sure people are not missing their signs and end up having a complication? Can we really monitor and save people's life? That's where the upcoming products and the pipeline, what I mentioned about future care, are kicking in.
So you have 3 products right now that I see. Are there more in pipeline?
Yeah, so the way we are positioning is as care systems. So the care systems will involve cardiac care system, hypertension care systems, then you will have kidney care systems,
Okay.
and diabetes care systems. So each of these care systems will have devices plus application and the services particular to that particular problem that we are going to address. And these care systems will go and end up going in every house in the future to make sure we are able to monitor these symptoms before it becomes very bad.
But how will it reach, how will these products reach every household? Every household, you're generalizing it, but
Yeah, I mean, yeah.
how will you make it affordable?
Correct. Very, I would say, very good question. So the way of approaching is also through a phased manner. Again, not everyone is going to buy directly in the beginning. It is mainly we are narrowing down to particular segments. Those segments which are very much open and receptive, and they have the disposable income for this.
Yeah.
And once we are cracking that channel, then we'll be able to reduce the price point and manufacture in a real mass, and then we'll be able to go to the next set of segments and then making it affordable. Again, not everyone will be able to purchase it. I mean, that's there.
Are ECG machines going to disappear?
No,
Big
no.
ECG?
Yeah. No. I would say it is again complementary. The way I can put is calculator versus maybe spreadsheet or Excel. Calculator, you can do calculations, but it is not replacing
The
Excel.
sheet.
Excel is doing advanced calculations, advanced reporting, and things like that.
So this is calculator, or
This is calculator. This is calculator wherein you are able to do calculation at any point, portable, all those things. Similarly, but you are able to do calculations, right? Similarly, we'll be able to get the ECG, get the sounds, make sure it is not a big, a cardiac issue, or monitor someone's symptom and make sure he is not having a cardiac arrhythmia or anything. That functionality we'll be able to do, But again, we don't want to replace existing ECG machines which are there in hospitals, because the utility is very different.
Okay.
Utility here, the the leads that we are going to give is for the particular person.
I see.
So it's like small, medium, large, like how we are having different shirts. Similarly, the leads will be given for a particular person. But when you're in a hospital, you are using a different bulb and gel and things like that. You are optimizing for the cost.
Yeah.
You don't make different shirt for a different patient. So different use cases.
So you've done a fundraise of about 16 CR. Do you feel rich?
No, not absolutely.
There is this money.
No. So again, this money is being given for us to go to the next milestone.
Okay.
And I would say we have done a good amount of that. As in, when we were taking the fund, we just had the first product. Now we have a set of pipeline of products going to the market, and the real return will come when we are able to deploy and get good good margins for the company, and provide a good exit to the investor. And once we go to IPO, that's when he'll become really rich.
So you said 4 to 5 years to IPO. Are you looking at more products or more sales or more capacity to produce? What is it? What are the key metrics on which you will base your decision to go to IPO?
Sure. So basically, we want to position ourselves as monitoring non-communicable diseases at home. That is our positioning. And when we say non-communicable diseases, cancer is a completely different animal. We don't want to touch that. Except cancer, you have cardiac diseases, pulmonary diseases, kidney diseases, hypertension, diabetes. These are our area. Wherein again, we don't want to build a what you call big X-ray machine or ultrasound for next 5 years for sure.
Right.
We want to develop, or we want to be in the space of IoT and AI,
Okay.
which is Internet of Things and AI. We are adding new capabilities which are not there in the current ecosystem. So earlier, again, ECG machine was very big. You could not get ECG at home. You could not get sounds at home. Now that is miniaturized. And again, there are many great companies doing this.
Yeah.
I have huge respect for it.
Okay.
And again, it's not a single company which can actually win. You will need multiple companies. Market is also huge. Few of the companies are a friend of mine. So, but again, it's we are not clashing or anything. It's all healthy competition that we have.
Great. It's been amazing listening to all of this. These 4 phases. First of all, thank you very much for giving that framework that made the conversation.
Thanks to Professor B. Ravi and Dr. Rupesh. They have written a book. Professor Ravi has written a book on it.
Okay.
Developing medical devices.
Okay.
People can go and refer.
What is it? Do you have the name?
I think it is Developing Medical Device Framework or something. Professor B. Ravi.
Okay.
I forgot the name, but you
We'll
can
figure it out.
You can put that in the link.
Okay. So, Adarsh, it's been great talking and deep diving into how you built through these 4 phases, and amazing how the ecosystem came together to support you, and also the clarity you've had since the beginning that I'm going to become an entrepreneur. And also detachment to the fundraise as a success indicator. That's something that I want the students to take away. Fundraise is not the success indicator of success. It just tells you that you're in the right direction. That money that you raise is for another milestone.
Absolutely.
It means more accountability.
Correct.
And when you begin, the students today are probably many of them. They're like, how will I get the money? What do I tell the investors? You are at an idea stage. How do you develop the product? Where will you find the support, mentoring that in your case you did? Those should be the questions rather than investors. What are they going to ask? Have you spent enough time with the users, with the customers? Have you done the immersion? Right? Those are the right things to worry about, and not the fundraisers. Fundraisers follow.
People often confuse, when a company is raising, $1 billion kind of a thing. People think, okay, the founder, be full rich and he will not come to office next day.
Yeah.
That is not the case. People will, the founders are always driven by the passion to solve a particular problem.
Yeah.
So even investment comes or goes or anything, they want to make sure the problem is solved. And people take passionate in solving problems in healthcare, in education, logistics, and so on. So I would say people won't become billionaire by raising funds.
Yeah.
So that big misconception need to be, detached as well.
Okay.
If people are thinking, okay, I will do a fundraiser and I'll be rich, no.
Yeah. Glad to that. Okay. See, the reason we are doing this conversation, as I mentioned earlier at the beginning as well, is to bring entrepreneurship closer to the students. They need to have more clarity on these questions that we are discussing, right? What are the right things to think about? What are the right problems to worry about? What is the right way to define the problem, right? So, through Guess India podcast, we are trying to answer the questions in the mind of students. And today, actually, I have live questions coming in into my phone, and I'm going to read out some of the questions to you.
Sure.
Okay. So this question is from Sneha, from actually IIT Mandi, one of the students there, and she's wondering whether the devices in which there is data sharing, health data sharing, digitally you are sending the data to someone else. Are there data privacy and regulatory challenges with respect to the privacy of the healthcare data?
Yeah, absolutely. I would say not as a challenge, but I think it's a basic requirement which is put in place for the right reasons. So whenever you are collecting patient identifiable data, you have responsibility to handle it in a way, and there are already standards which are guiding like HIPAA and even Indian standards are there. You will have to comply and adhere to it. Then only it's good for the whole ecosystem. Otherwise, you can't just take someone's data and share it in some other place. You should be accountable for the data privacy as well as the regulation which is safeguarding the patient and the whole ecosystem.
Yeah. Okay. So that's the answer. It is, yeah, these issues need to be thought through.
HIPAA complaints, there are complaints they can get, and even DP, there is a name, I'm not getting it, some name related to the complaint specific to India also.
Okay.
You need to comply to that.
I have another question from Ujjwal, Ujjwal Chopra. He's a campus ambassador with GUESS. He's saying he thinks you're an IITian. So to clarify, Adarsh did not study in IIT Bombay. He did his engineering outside of IIT Bombay in Karnataka, right?
Right.
In Karnataka. You named the college earlier. And he went there as a researcher in the lab, and that's how he had this opportunity to build it. And his question was how he got interested to enter in the medical field and make these incredible products. I think that we have answered earlier.
Yeah, sure.
So we'll skip this question. Let me look for more questions. Hold on a second. What are the things required to scale a health tech startup in India, specifically in the field of healthcare? There are lots of cost of the production, the material that you require. Are you a profitable company now? Are you making more than the cost? And they've done research. They know that Japanese venture capital is funded. Okay, so what are the, how do you scale in health tech? This is the question from Om Ahuja.
Yeah, sure. I think in healthcare there are multiple types of companies. Let's say people who are going fully into developing molecule or compounds or anything. I think for them the journey is different than device like ours.
Yeah.
So maybe I'll answer how we are doing it. So the way for us is, once you are able to increase the lifetime value for the customer, then you'll be able to make more products and sell to the customer and create profits from that. And again, we were profitable, in the, I would say, beginning, but we tried to take a larger ambition, and I showed you the things what we are working on. So it requires significant manpower to develop AI capabilities as well as the hardware capabilities, and we'll be we are reinvesting the profit whatever we were getting to again back to the company, because you can't limit with a single product is what I've come to a conclusion, because if that is the case, then you will have to sell to the world
Okay.
to have a good scale. Otherwise, you will have to pick a sector. In the sector, you need to build a, I would say, integrated approach, and you need to have your solution in each of the the intersection of the integration.
Okay.
That's when you can actually extract good value from the customer as well.
Okay. All right. Next question is, I don't have the name here. What advice would you give to a student with zero capital who wants to build a health tech startup?
Yeah, again, capital is not the first thing required to start a company. What you will need is insight about a customer problem, insight which is good enough, which will make a viable venture. And if you're able to get enough proof of that, then you can either get into an incubation center, or you can get into any Nidhi EIR or any of the EIR fellowship programs. And from there, you will get support grants and funds or anything to build your initial version, or even you can go for angels. Angel investment has become a good platform very recently. But again, no one will fund if you say I don't have anything, I just have an idea, give me a 10 lakh or 20 lakh. No one is going to give unless you are a second time founder. So for the first time founder, mainly you will require insight, validation from market that the problem exists and it is real, and there'll be willingness to pay.
So work on the problem. Worry about the problem,
Yeah, not
not the
solution.
money. Okay. Aditya has a question saying there are numerous healthcare products and probably you have competitors as well. We haven't discussed it. How are you making sure that your product stands out?
Sure. So again, I would say competition is a good thing for the end consumer as well as for the companies.
Okay.
And the way you go ahead is you have to keep on innovating. And if you are not innovating, you'll be dead. We have like famous case studies, I would say the camera, Kodak, and all those things, right? So if you are stopping innovation, and if you are thinking someone else is going to innovate and have a better product, and you're going to lose the market. So key is don't become compensate. I mean, what do you call, being yourself and thinking, okay, now I've done the thing, it will be fine. You need to go to market, understand what is the pinpoint again. Are you solving it? What are the gaps? Come up with a better product. Keep on innovating. That is a single thing I can tell.
Kavya asks, I also want to start a health tech startup. I have my pitch deck ready. Would you talk to her?
So yeah, I mean, maybe I would say, even if you're thinking, you're feeling that you are having idea, you are having all the things, but you are even bit scared to start something. Best option I can even give is to start and work in a startup for a couple of months in the same field.
All right.
And then but disclose this in the beginning itself. So the founder knows the path.
Yeah.
And then you can go and do it. Pitch deck, everything is good, but single line, what is the elevator pitch?
Yeah.
What is the problem inside that is, that is discovered? That is what people will be interested to hear. Pitch deck, I can give just a input or a prompt to ChatGPT, it will give me a pitch deck. But the difference will be how many people you have met, what did they uniquely say, does it make sense, will it be viable? This, if you are having answer to these questions, you don't even need a pitch deck. You can just even send a WhatsApp message.
And
That should be good enough.
Okay, great. So we are coming to the conclusion. There are many other questions which I have not asked, but I think it will make it a very lengthy conversation. And so let me just conclude here. We've learned very interesting things and very different setup: hardware, medical, an engineer, team chemistry, something in the childhood, running away from something, you run into that back. Team, the ecosystem, incubation center. We haven't actually spoken a lot about role of sign in all of this, but not to prolong this conversation too much, let us give some messages to the students from your journey? You've said a lot, of course, but parents, they, I don't know how open they are today. What happened in your case? How did your parents react when you said, I want to become an entrepreneur and I'm going to do this and not taking a job?
Sure. So my family has been very supportive. Father is a farmer. Then mother was a nurse, as I mentioned. Now she is retired. Then I have a brother as well. So they are all very supportive. But sometimes again, mother is more emotional, and when she is seeing you are, running around things, she'll be like, what if you just take a corporate job? Will it be better for you? These questions I get, asked. But I have got good enough support from father and everyone to go ahead. And again, I would say there is a mind shift which is also required from parents as well as from the faculties mainly, I would say.
Okay.
Okay, immediately after graduating, okay, even if you are not pushing to startups, but if someone is thinking in long term you want to do it, there should be enough knowledge and enough framework which has to be given. Because I would even say now we are living in the age of AI. Any job is getting displaced left and right. If we are creating value eventually as a as a value contributor to the economy, you will have job. So again, best way of creating value is creating venture. But again, I will not recommend for people just to go as a fancy thing.
Yeah.
You should have passion for it. There will be tough times. You should be okay to navigate and not complain saying I did this because someone said.
Yeah.
Versus you should say no, I know it will be risky. However, this is something I would
want to do.
love doing it.
What is the message to the parents?
Yeah, parents, I think if your son or daughter says this, they want to pursue entrepreneurship, uh, I would say be a good mentor, and support. It is something which makes them really happy doing it. Imagine them working in a MNC for 6 days or 5 days a week and complaining the whole day and not happy, versus someone who is trying something and will not have an immediate capital outcome. I would say in the long run, when they are sticking around and working for some 6-8 years, they will be even if they are doing really good and putting their heart and soul, they will be even actually 5 to 10 times better than someone who just went for a corporate world. Again, I would say corporate is also a great thing, providing good boost to the economy. But again, if someone is feeling that he should pursue the entrepreneurship role, I think he should be supported.
What is your message to the faculty?
Yeah. So faculty, I think India as a country, we have come a long way from roti kapta makan now to now Swiggy, Zepto, all those things, wherein we have now we can pursue the ambition that we want, but mentorship and guidance will be required. And I think all faculty, even I would say the government should relook at how do you strengthen this, even for the students as well.
Yeah.
Maybe some, I think BITS or somewhere they are giving this 1 year off. You can go and try out things and come back and start again.
Yeah.
Or you can again apply for the company for placement. As an employee, I mean as an employer, I'll be more happy to pick this kind of people who have actually ventured out and done something, because they will be more practical and they'll know the in and out of things. So I would say maybe in policy people should work, should have incubators in every college. There should be push for it, because I think as a country we have so many challenges. We have the manpower. We can lead the world in this only if we make sure we are able to lead this startup revolution. There are a lot of things which has happened, good part from Shark Tank and all.
Yeah.
However, it need to be made as a process. We need to teach lean process, lean startup process to all faculties.
Yeah.
And there should be a faculty champion in each of the institute who should take this up and mentor startups.
Yeah.
Mentor and again I would say one more thing is there should be a mechanism wherein you also pay back to the advisors or mentors as a faculty member as well.
Yeah.
So now I think IITs are opening up for that. And if that happens, then I think we'll have a good decades ahead. Otherwise, the contrary is really bad. So the chaos of job loss and people not having purpose and things like that.
Yeah.
But I think ignition has started, but it need to happen at scale. We are having, I think, we are just talking about this. I'm very congratulating you for the initiation you have taken. But I think we should have 10 times podcast like this. We should have 10 times incubators.
Yeah.
And only, IITs is not enough.
Okay.
You will need, even hospitals coming up, for incubation centers. You should have all the places wherein people can get support for the ecosystem. So that's what is there in the West so far. But India also now, I would say we are catching up very nicely. But I think more work is required.
More work is required. Yeah, always more work is required, and an entrepreneur is never satisfied. they're positively dissatisfied. Great. This was a great conversation, Adarsh. I wish you and your venture all the best. And we'll talk again when you do the IPO.
Thank you, Professor Puran. It was pleasure sharing my journey and the milestones, struggles, and the wins and all. Very much happy that you are doing this. I hope people will learn from this, and I have my LinkedIn. People want to connect, they can
Yeah.
connect over LinkedIn, and we happy to share.
Yeah, there is a great pros that people like ourselves, entrepreneurs who were students who were in academic environments, like who took the plunge. There is very important role for you to play in now assessing the students who want to become entrepreneurs. So please don't get so busy in your IPO preparations that you don't find time. Please give times to the students to nurture them, to guide them, to mentor them, whatever little that you can. Sure. That is for you, and that is for all the entrepreneurs who are out there. The students need all the mentoring that they can get. They need to learn from experiences. There are no books. There are no books. There are no resources which are telling us how students became entrepreneurs and not have been that ability. And that is why we have to start talking to the students that are entrepreneurs like this. So I'm sure students who are listening it, students who are listening to all these conversations, they are finding a lot of inspiration, a lot of sort of material to reflect on and to find their first few steps towards entrepreneurship. Thank you very much.